Dr. John Torres here with NBC News on this Facebook Live, and thanks for watching us here, and hopefully you have some questions, so please send them in so we can answer as many of those as we can at the end of this. But first I want to talk about a couple different headlines you might have heard about. Number one, you're hearing about a lot of hospitals and hospital systems, the American Hospital Association and some other ones are saying it's okay to go to hospitals because it turns out the doctors are noticing across the country, this has been a trend over the past couple of weeks of people who think they might be having a heart attack, people think might be having a stroke, even people who think they might be having appendicitis have not gone to the emergency rooms, have not gone to the hospital. And the main reason is because they're afraid of getting coronavirus, of COVID-19. The whole honesty of the whole thing here is that essentially one of the safest places you can actually be is the hospital, because they are doing a very good job of making sure that if you do come in and you don't have coronavirus, that they keep you protected from those who they suspect might have it. Sometimes they have separate coronavirus floors. They'll isolate people in the emergency rooms and other areas, but they definitely want to take care of you, especially, again, if you think you're having signs where you need to go to the emergency room, still go to the emergency room. It's important because some of these could be life-threatening signs. If you think you're having a heart attack, and the basic signs are, shortness of breath, chest tightness, having some sweatiness, maybe feeling a sensation down your arm, even extreme fatigue can all be signs of a heart attack. If you're having issues like that, then it's definitely something you want to go to the emergency room for to take care of. Also, if you're having symptoms of a stroke, the stroke symptoms are fast. We're talking face. If you notice your face being asymmetrical, in other words, one side seems to be drooping and the other side doesn't, that could be a sign of a stroke. Also, arms. Have somebody hold up their arms, and if they notice one drooping, that could be a sign of a stroke. S, speech. If they're noticing slurred speech or confused speech, that could also be a sign of a stroke. And then T, again, F-A-S-T, T is time. And the reason that's in there is because time is brain. Same thing with chest pain and suspected heart attacks. Time is heart muscle. It's important these things get taken care of as soon as possible. So don't avoid going, don't wait to go. And there's been numerous stories around the country of people that have had issues, suffered issues, and had problems because they didn't go in even though they thought they were having a heart attack, even though they thought they might be having a stroke. Or even if you fractured a bone, you have a large laceration that probably needs suturing, especially if it doesn't stop bleeding. If there's pregnancy complications, definitely want to go into the emergency room. Treat it like you would any other time. But just remember again that they're doing everything they can to keep you safe from coronavirus while you're there. And it's actually a very safe place to be if you don't have coronavirus. So again, if you have any of those issues, don't hesitate to go to the emergency room. That's number one. Number two, you might have heard that last night on the coronavirus task force briefing, President Trump actually said a couple of things that I want to just make some points about that, make it very clear. He said that essentially looking at two different things, disinfectants and UV light, that if we can get disinfectants, if people can get that into their body, it should help out with killing the coronavirus, this virus. Absolutely not a thing. That does not happen. You should not inject, ingest, or inhale any kind of cleaning disinfectant solution, whether that's bleach, whether that's the cans of Lysol or anything else that are sprayed. Any of those disinfectants you don't want to get into your body because, number one, they're not going to kill the virus throughout your body, but they could be toxic and they could kill you, so you want to be very careful with that, especially around children. As far as the other one, the UV light, what he also said is if we can shine UV light on ourselves and get UV light inside ourselves, then that might actually help out too, and he was telling his scientists to go ahead and look into that. The reason we put sunscreen on in the summer is because sun, which has UV light in it, can actually cause skin cancer, cause skin damage, and so we want to be very careful with that. And so again, the UV light, number one, there's no real technique for getting UV light from the outside inside our bodies. Now you might have heard they're using UV light to disinfect face masks and other things. That's very specially done. They do them in special rooms where people are protected. They're usually out of the room when they shine that UV light. It's only there for a few minutes to disinfect what they need to disinfect, and people usually aren't around because it's that dangerous to people. So again, as far as disinfectants, do not inhale, ingest, or inject any disinfectant because number one, it's not going to kill the virus, and number two, it's going to cause you some harm. And UV light. Be careful with UV light, much like you are in the summer when you go outside and you're doing things out there. So again, this is one of those things you want to be very, very careful with. And even though it was said last night, it's one of those things, again, that you have to look at the science and say, science does not support that. Please do not do that. And we know that calls are going to go up in the emergency department. They already have for people over the last couple of weeks that have been poisoned with cleaning solutions inadvertently. We don't want that to happen when people are doing it, trying to control coronavirus as well inside their bodies. So let me see if we have any questions here.
Yes. Does being exposed to more virus particulates or particles make the virus more deadly?
So the question is, does being exposed to more virus particles actually make the virus deadlier or more deadly? And the answer is yes, it does. It can, especially in certain situations. Now, what we look at is something we call viral load. And the viral load is how much of the virus you're actually exposed to, how much of that virus gets into your body. So if you're near somebody and they're coughing and sneezing and those respiratory droplets come towards you and you inhale those, you're going to get a big dose of viral load. You can get a lot of virus in your body. If, on the other hand, somebody ended up coughing on their hand, touching a surface, you touch that surface a few minutes later and then wipe your nose or your mouth, you're going to get a small viral load. And what we're finding out is people with smaller viral loads, and this is the same across a lot of viral infections, with small viral loads with coronavirus, you don't get quite as sick as you do with big viral loads. And that's why you're seeing a lot of healthcare providers and frontline workers getting very sick and some even dying because they're constantly being exposed to coronavirus. They're constantly in people's face when they're intubating somebody. You're essentially this far away from somebody as you're trying to get that breathing tube into their lungs. Air might be coming out. If it is, it's going to come out full of viral particles. Even though you're wearing masks, those are N95s. They're 95% protective, but 5% can still get through. And so again, it's one of those things that the more you get affected by that viral load, the more impact that viral load has on you, the more likely it is to be a deadlier virus. So you want to be very careful. And that's why we're saying that 6-foot distance is important, because if somebody does cough or sneeze, even if it makes it to you, that viral load is going to be very, very small. And getting it as small as possible is most important. The reason is because once that virus hits your body, your immune system is trying to fight it off. It's essentially two armies fighting each other. The virus, which is its own army, and your immune system. If the virus has a bigger army, it's going to overwhelm the immune system and won't be able to fight efficiently, won't be able to fight completely. And so getting that under control is important. Not getting a huge viral load is equally important. So that protection, the masks, staying 6 feet away, those are all important to make sure that viral load is as small as possible. So let me see if we have any more questions.
How do we protect ourselves from micro droplets?
So the question is, how do we protect ourselves from micro droplets? And micro droplets are essentially, again, we talk about respiratory droplets. So if somebody coughs or sneezes, you're going to get this huge flow of droplets coming out. And that's usually within 3 to 5 feet. A little beyond that, you can get micro droplets. And when people talk, micro droplets come out. It's not that huge amount of particles that come out, but micro droplets can. When they sing, same thing. If you look on a cold winter day when somebody's breathing and you see that fog around their breath, that mist, those are essentially the micro droplets that are coming out, the respiratory droplets, that if you're that close and you inhale those, you could inhale the virus if they have it. And so that's why we're saying that 6 foot is very, very important, because you want to stay away from it. So anytime this is a respiratory illness, so anytime it gets into your lungs or it gets into your nose, your mouth, or your eyes, you can get infected with coronavirus, and that's why it's important to stay so far apart. Masks can also help too, because we now know that up to 50% of people with coronavirus don't have symptoms, might not even know they have it. So if they're simply talking like I am right now, those micro droplets and those respiratory droplets will go out about this far. So if somebody's that close to them without wearing a mask, chances are they're going to catch it as well. So you want to be very, very careful, especially in situations where there's mass transit or you're an essential worker and you can't get away from other people because you're a caretaker, or situations like that. You want to be very careful and make sure that you have your own personal protective equipment, and that's usually a mask and goggles to protect yourself. So let me see if there's others.
Yes. Can you get it more than once? I mean, we talked about antibodies, but how does that work?
So the question is, can you get coronavirus more than once? The answer we think right now is no, but you have to remember this is a new virus we're still learning a lot about. But based on our knowledge of old viruses, especially coronaviruses that have been around before, it doesn't look like you can get it a second time. If you had it once, you recover from it and you have antibodies. And that's why we're so looking so hard at antibody testing. Antibody testing will tell us whether somebody has antibodies built up from being infected before, even if they didn't show any symptoms. And if they do, we think they're going to have some type of immunity to coronavirus, meaning they're not going to get it right away. We don't know how long that immunity will last. Thought is it'll last at least a year, might last longer than that. There's even a hope it could last a lifetime. We simply don't know, because this virus has only been around for a few months. We have to wait for a few seasons to find out how long it actually lasts. But the important thing is that once you get it and you recover from it, you're not going to get it again, at least in a near-term basis. Now, part of the reason for the question, and I do get this question quite a bit, is because in South Korea, they found people that actually had tested negative for corona. They had coronavirus, they recovered, they tested negative, only later to test positive again. It's what they call a reactivation. Reactivation is different than reinfection. Reactivation means that test, they think, detected some residual viral particles in their body. So they weren't sick, they were still trying to clear out the virus they had before. And so they don't think those viral particles, since it's not the entire virus, can actually infect somebody else at this point. But again, we're learning a lot about this. The other thing they think might be happening is that those tests in between where they tested negative might have been faulty tests, because no test is perfect. And we're finding out more and more that some of these tests aren't even nearly as good as we thought they were. And so it's possible that the tests weren't that good. The negative tests were actually false negatives, and they were positive the whole time. And so again, it doesn't look like somebody who gets it, recovers from it, can get it again, at least in a short-term basis.
Why don't we require people to wear goggles if you can get it in your eyes? Just masks.
The question is, why don't we require people to wear goggles if you can't get it in your eyes? If you can get it in your eyes, why are we just saying masks? Because the most likely way you're going to get it is through your nose or your mouth. Getting it in your eyes is a little more a function of touching your eyes and getting it in that way. If you think about it, if somebody's coughing or sneezing towards you, one of the first things you do is you blink, and so that's going to protect your eyes, but you can't do the same thing with your mouth or your nose. You can hold your breath, but you can only hold it for a certain time period. And so again, goggles, that gives you more protection, but from the respiratory droplets, especially if you stay that 6 feet apart, it's not going to be that big of an issue going into your eyes. Your mouth and your nose definitely, and so that's why we say you want to cover up with a mask. On top of that, one of the biggest reasons behind using a mask is because we're trying to prevent people who don't have symptoms but have coronavirus from infecting other people. And so they're not going to infect them through their eyes, but they could infect them if they cough or sneeze. And so the hope is wearing a mask, if they do cough or sneeze, or even if they're talking and those respiratory droplets come out, the mask will catch that. And so the main reason behind the mask is to protect others from you in case you have it, but it also supplementally can protect you from getting it from them to a certain basis. It's a small bit of protection. The eyes, not as much a big a concern, but if you are concerned, it's simply wearing goggles of some type can help out.
When do models predict we should have herd immunity? At what point?
So the question is, this is actually a great question. When do the models, the mathematical models, predict that we should have herd immunity? At what point do we think that'll happen? It's going to take a while to get herd immunity, because in order to get herd immunity, you need a huge percentage of the population who's been infected, recovered, and actually has immunity to it, or has gotten the vaccination because of it. If you think of flu or measles or any of those other ones, herd immunity happens around the 90% range, 93, 95% range. This, we're not even close to that. Right now, we think, depending on where you are, 10 to 40% of the population might have been infected. Some places like New York City are on the high end, other places didn't get quite affected by this on the low end. And so this is one of those things that it's going to take a while to get herd immunity when these new viruses come through, and they're called naive viruses to our body because our bodies aren't used to them. We've never seen them before. When they come through and our bodies are naive to them, it's going to cause some issues, and it's going to spread very, very quickly. Once our bodies get used to them over a few years, that herd immunity starts building up. It's not going to spread quite as fast, and we're going to be more protected from it. Plus, once we get the vaccine, that'll help as well. But that was a fantastic question. Thank you.
How long do we expect COVID-19 to stay in someone's system? Do we know yet?
So the question is, how long do we think COVID-19 will stay in somebody's system? Do we know yet? To a certain extent, we do. And what we're finding out is that when people get sick, they typically get sick for about 2 weeks. And then if it's mild or moderate illnesses, they get sick for a couple weeks. Beyond that, they end up having, if they're critical or serious, that looks like it goes 3 to 6 weeks. And so anywhere from 2 weeks to 3 to 6 weeks is when they get recovered from this. The CDC has some very specific guidelines. If somebody tests positive for coronavirus, they say they want you to have 2 negative tests 24 hours apart before you can leave isolation. If you don't have testing or can't get testing, then what they say is you want to go ahead and be fever-free for 3 days and symptom-free for 3 days, but you've also had the disease for 7 days. So at least 7 days since the disease started, you stopped with the disease, and now you're fever-free for 72 hours or 3 days. And at that point, without testing, they say it's okay to go out and about. You still want to be careful, though, not just for yourself, but for other people around you, because this can be such a devastating disease.
And I have one more. Diamox. Are there any truths to a treatment for that? So
the question is diamox. Are there any truths to a treatment for diamox? Diamox is one of those medicines we use for altitude sickness. And part of this question might come from a news story that came out a couple weeks ago saying that people in Colorado were having worse times with coronavirus because of the altitude. So diamox works for altitude sickness. We don't have any indication it's going to work for coronavirus or COVID-19. The reason I think this question is being asked, and I've heard other people ask it as well, is because of that story that came out saying that Colorado people were having a hard time, especially those above 7,000 feet because of the high altitude. In fact, what was happening is the high altitude wasn't causing them to get coronavirus more, and it wasn't even really worsening most of the coronavirus symptoms, but what it was doing was causing issues with their oxygen levels. Mainly because when somebody has coronavirus and their oxygen levels start dropping, we get concerned, especially when they drop to about the 85% range of oxygen saturation, we call it. The problem is at sea level, your oxygen saturation is usually 95 to 99%, which is an acceptable level. It drops below that, we start getting concerned. At altitude, like in Colorado, 92% is an acceptable level. So you can see between 85 and 92%, you only have 7 points you can drop. It's a small reserve versus 85 to 95%, there's 10 points. That's a huge difference when it comes to oxygen saturation. So people at altitude have less reserves, and that's why they're saying if somebody had coronavirus, especially the pneumonia affecting their lungs, they were looking at moving them down to lower altitude because they want to make sure that they have that reserve, so even with the supplemental oxygen that they can still breathe as well as they can. So it's not that they'll catch it more, but it's the fact that if they catch it and they get pneumonia, it could be more of an issue because they're not breathing quite as well, quite as efficiently. But as far as diamox working for it, it doesn't look at this point like that will work for it. So again, thank you for listening to this. Your questions were fantastic. And remember the 2 news stories. One, about the disinfectant. Even though you might have heard something about this, do not ingest, do not inhale, do not inject any disinfectants. They do not work, and they can cause a lot of toxic reactions. You want to be very careful with that. And UV light on your skin will not get inside your body, number one, so it won't affect the virus that's inside your body. And if it does hit your skin, it can cause issues with developing skin cancers. You want to be very, very careful with. So again, thank you very much for watching this. I hope you have a fantastic weekend. And most importantly, stay safe, stay home, and we will get through this. Thank you.